About half of the women in the United States will have a miscarriage at some point during their lives. About 5% will have 2 miscarriages, and 1% will have 3 or more. Most miscarriages are due to chromosome abnormalities which can't be prevented, but most is not all. Fertility experts like me are always looking for treatments that could reduce the risk for a miscarriage. Could something as easy as a low-dose aspirin help? Stay tuned. Aspirin, also known as acetylsalicylic acid, has been around for a long time. It was first created by a French chemist in 1853. A standard aspirin tablet in the United States contains 325 milligrams of aspirin. Smaller doses of aspirin, ranging from 75 milligrams to 81 milligrams, are available and commonly referred to as baby aspirin or low-dose aspirin. Low-dose aspirin has been commonly recommended to reduce the chance for heart attacks in men. On this previous episode of Infertility TV, I talked about whether low-dose aspirin has any benefit for couples who are being treated with IVF. For several years, there has been interest in whether low-dose aspirin could reduce the risk for miscarriage. Why? During pregnancy, the fetus gets all of its oxygen and nutrients from the placenta. The placenta gets oxygen and nutrients from tiny blood vessels in the uterus called spiral arteries. Some miscarriages are thought to occur because of constriction or blockage of the spiral arteries. Aspirin at low doses can help dilate blood vessels and prevent blockages by keeping a type of cell called platelets from forming plugs. Theoretically, low-dose aspirin could help reduce miscarriage risk. Past studies, however, have been unable to prove it really works. This study combined the data from 2 smaller studies but failed to find a benefit. There were only 250 women studied in this review. Next, there was a bigger study of over 1,000 women. This was known as the EAGER trial, Effects of Aspirin in Gestation and Reproduction. This was a well-designed study. About half the women were given low-dose aspirin and instructed to take one every day. The other half got a placebo or fake pill with no medication in it. The women didn't know whether they got the real aspirin or the fake. Approximately 12 to 13% of the women in each group miscarried, so there didn't appear to be any benefit to taking low-dose aspirin. Recently, some researchers went back to the EAGER study data. They studied those women who had 1 or 2 miscarriages before they enrolled in the study. They knew that some of the women who were told to take the low-dose aspirin every day didn't take it. These women were still analyzed as part of the aspirin group even though they didn't take the aspirin. They thought that this could have thrown off the results. When they compared the miscarriage rate in women who actually took the aspirin to women who didn't, they found something pretty amazing. Out of every 100 women who took low-dose aspirin for at least 5 days each week, there were 8 more women who had a positive pregnancy test, 6 fewer miscarriages, and overall 15 more live births than women who did not take aspirin. That's a 15% increase in the live birth rate. Our Infertility TV bottom line is this: if you have had 1 or 2 previous miscarriages, taking a low-dose aspirin every day starting before you become pregnant would seem to improve your odds for having a live birth. It is still uncertain whether women without any previous miscarriages would benefit the same way, but as long as you don't have any medical reasons that you can't take aspirin, this would seem to be an easy, inexpensive, and low-risk way to improve your odds for having a baby. If you would like to set up a one-on-one consultation with me by video, check out my website at ivf1.com. But before you go, don't forget to subscribe to Infertility TV. It's like having a fertility specialist in your phone.